Have you been feeling numbness, tingling, or pain in your hands or feet that just won't go away? You're not alone. And today, we're going to tackle the 9 most common questions about peripheral neuropathy to help you understand what's happening and what you can do about it. Stick around. This might just change the way you think about your pain. Hi, I'm Dr. Chris Cameron, and for 24 years, I've been helping people in Lucan manage pain and improve their quality of life. At Cameron Family Chiropractic, we use advanced treatments like laser therapy, shockwave therapy, vibrational therapy, spinal decompression, custom orthotics, and electroanalgesia to provide real relief without invasive surgery or medications. Let's jump into the questions I hear most often about peripheral neuropathy. Question 1. Can stress cause neuropathy or make it worse? Stress isn't usually the root cause, but it can make your neuropathy symptoms a whole lot worse. Think of stress like adding gasoline to a fire. When you're stressed, your body releases cortisol, which increases inflammation. Over time, this can damage the tiny blood vessels that feed your nerves, starving them of oxygen and nutrients. This makes the numbness, tingling, or pain even more intense. Managing stress is crucial for nerve health. Techniques like deep breathing, light exercise, or even 5 minutes of quiet can lower stress levels and help your nerves function better. Question 2. Can diabetic neuropathy be reversed? This is a big one, and the answer depends on the timing. In early stages when nerve damage is still mild, we can often see great improvements. Controlling blood sugar, staying active, and eating an anti-inflammatory diet are key. For more advanced cases, the focus shifts to managing symptoms and preventing further damage. Treatments like laser therapy and electroanalgesia can help improve nerve function and reduce pain. Think of it like catching a leaky roof early. You can fix it before the damage spreads, but the longer you wait, the harder it is to repair. Question 3. Can peripheral neuropathy just go away on its own? Unfortunately, neuropathy doesn't usually vanish without help. If it's caused by something reversible, like a vitamin deficiency, addressing that can make symptoms improve. But if you've been living with it for a while, the key is stabilization and targeted treatment. At our clinic, we use therapies like spinal decompression and vibrational therapy to improve blood flow and stimulate the healing process. These treatments create the ideal conditions for your nerves to recover even if the damage is more advanced. Question 4. Can neuropathy be treated effectively? Yes, and here's where individualized care really shines. Treatments often need to address both the root cause and the symptoms. For example, custom orthotics can reduce pressure on your feet, while laser therapy promotes nerve regeneration. Electroanalgesia can reduce pain by calming overactive nerve signals. It's like fixing a broken garden hose. You need to repair the hose itself while making sure the water flow is steady. Combining multiple treatments gives us the best chance of improving your condition. Question 5. Are compression socks good for neuropathy? Compression socks can be a useful tool, but they're not a magic solution. They help improve circulation, which can benefit people with neuropathy caused by poor blood flow, like diabetics. However, if your nerves are hypersensitive, compression socks might feel uncomfortable. It's always best to check with a healthcare provider to make sure they're right for your specific case. And remember, they work best when combined with other treatments like spinal decompression or shockwave therapy. Question 6. Should I stay off my feet if I have neuropathy? Not entirely. While too much standing or walking can worsen your symptoms, staying completely inactive isn't the answer either. Movement helps improve circulation, which is vital for nerve health. Low-impact exercises like swimming or using a stationary bike can be fantastic options. Think of your nerves like a plant. They need a steady flow of water, or in this case, blood, to stay healthy. Too much strain dries them out, but total neglect won't help them either. Question 7. Can you live a long life with peripheral neuropathy? Absolutely. Neuropathy itself isn't life-threatening, but managing the underlying cause is essential. For example, if it's related to diabetes, keeping your blood sugar in check is critical. With proper care, including therapies like laser therapy, spinal decompression, and dietary changes, you can significantly improve your quality of life. Many of my patients with neuropathy live active, fulfilling lives once we get their symptoms under control. Question 8. What are the worst foods for neuropathy? This is a big one because diet plays a huge role in managing neuropathy. Foods high in sugar, processed carbs, and unhealthy fats can increase inflammation and make your symptoms worse. Think of these foods as pouring salt on a wound. They're just going to make things worse. Instead, focus on anti-inflammatory options like leafy greens, berries, fatty fish, and nuts. Turmeric and ginger are also great for reducing inflammation naturally. Question 9. What are the best vitamins for nerve repair? Certain vitamins are like super fuel for your nerves. B vitamins, especially B12, help repair nerve damage and reduce inflammation. Vitamin D is another powerhouse. It supports overall nerve health and helps prevent pain. Alpha-lipoic acid, an antioxidant, can improve nerve function and reduce tingling or burning sensations. Pairing these vitamins with a nutrient-dense diet can make a noticeable difference in how you feel. So, there you have it. The answers to the 9 most common questions about peripheral neuropathy. If you've been suffering with numbness, tingling, or pain in your hands or feet for more than 12 weeks, it might be time to take action. At Cameron Family Chiropractic, we offer advanced, non-surgical treatments like laser therapy, spinal decompression, shockwave therapy, and electroanalgesia to help you feel better and get back to doing the things you love. Give us a call at 519-227-1363 and let's talk about how we can help you find relief.